Let's talk about BDNF. The purpose of BDNF, it changes the formation of new brain cells and protects existing ones. So its function is increases brain plasticity, which is very important for people with traumatic brain injuries, especially among my NFL athlete patients. And this explains why some of them will recover from a brain injury better than others, and why some will still suffer from cognitive impairment, word finding difficulties, memory loss, just general functioning in daily life. Suppresses brain inflammation. Inflammation is a huge thing now when it comes to explaining why people feel depressed. And it acts as a natural antidepressant. Why? It makes the brain healthy. It's all about brain health. Everything starts here. It's not about like how you feel. And it offsets the negative effects of stress on the brain because it's anti-inflammatory. And it protects the brain from neurodegeneration. So I picked on this example before. The ones that are poor secretors or BDNF are the ones that are, we call the MET carriers. They have lower levels in the brain compared to others. So what are the symptoms? When we talk about the function, then we can understand why somebody will be depressed, why somebody will have unstable mood, somebody will have anxiety, cognitive impairment, inattention, memory loss. The treatment for it, it's really just a three-prong approach. How do you increase the BDNF in a patient that is a low secretor of it? Lithium. Lithium does it. I think this is the reason why some bipolar patients don't respond to anything but lithium, because we didn't realize that they were poor BDNF secretors. But the good news is you don't necessarily have to give therapeutic lithium. I give some of my patients this 5 milligrams of lithium orotate, and they do just fine. So this was proven in a journal of Alzheimer's disease. Lithium increased BDNF in early Alzheimer's. Intermittent fasting, the Journal of Brain Science, February 2021. Intermittent fasting showed to increase BDNF. Exercise, interval exercise particularly. eLife Journal, June 2016. Exercise releases beta hydroxybutyrate, in turn induces BDNF promoters. So if you can see this treatment, they don't necessarily have to have psychiatric medicines, but lifestyle is how they treat the low BDNF. So for more information, this is a source I use. Genomine, it's great. Oops, I wasn't supposed to mention that. But they've taught me a lot. It really, really changed how I look at genetics. So instead of looking at the back saying A, B, C, D, this is what I should give, I start with this in order to help me understand which direction to go with a patient or not.